Now, this coming weekend, we'll see members of 3 Rotary clubs in Pretoria, in partnership with the South African Vaccination and Immunization Centre, embarking on an awareness campaign about polio, as well as a vaccination drive to vaccinate children aged 0 to 12 years against polio. Now, the campaign and vaccination drive are in the wake of recent reports about the wild poliovirus outbreak in Mozambique, and is also in observance of World Polio Day, which is marked globally on the 24th of October. Polio is a viral vaccine-preventable disease which is highly infectious and potentially fatal, with no cure, and affects mainly young children. Dr. Stella Anyangwe is an epidemiologist, the global health expert and coordinator at the End-Polio-Now campaign, and she joins us for this conversation. Dr. Anyangwe, thank you for being with us. Welcome to Morning Live.
Thank you very much, Leanne. It's a pleasure to be here.
So polio, I mean, when we go back in the history books, I don't know whether to say was or is, a devastating thing. As I outlined in the introduction, it's highly contagious, it's very, very dangerous. But how far are we? I had thought we'd gotten to the point of almost eradicating it.
Yes, we have, but we are not there yet. And the question is, if not, why not? Polio has been the flagship project of Rotary International since 1985, when it was thought that because polio is a vaccine-preventable disease, it's something that can be eradicated. Up till then, there was only one human disease that has been eradicated, and that's smallpox. In 1998, Rotary came together with partners and formed the Global Polio Eradication Initiative. As of 1988, there were about 350,000 cases of polio, wild poliovirus paralytic infection each year. And so Rotary and partners said, well, if just vaccinating children will eradicate this disease, let's embark on it. It looked doable. We thought by 2000 we should be there, because 1988 till 2000 seemed like a long way off. But the virus is a very wily virus. Yeah. And we kept on pushing the goalposts. Yeah. Right now, this year, as we speak, 5 out of the 6 World Health Organization regions in the world have eradicated wild poliovirus. Only 2 countries in the world still have endemic circulating wild poliovirus. And these countries are Afghanistan and Pakistan. In 2020, in August, Africa, and I'm wearing an African t-shirt because we gladly were certified to be wild poliovirus free in 2020. When Nigeria, which was the last country still circulating virus, had been free of wild poliovirus for 3 years. And we thought we were there. But 2021, we were shocked to find out that we had 1 case of wild poliovirus in Malawi, which had not seen wild poliovirus infection for years. South Africans, many of them still ask you, is there still polio? They've never seen it. They don't see children being paralyzed these days. They don't know that it still exists. And then 2022, this year, as of last week, we have 7 cases of wild poliovirus, paralytic infections in Mozambique. None of the people infected had traveled, and the virus is linked to a viral strain in Pakistan, which just goes to say, if there is polio somewhere in the world, wild poliovirus, everybody is still at risk, because the world is one big global village.
Yeah, it certainly is, and I think that's certainly something that we've learnt as we've come out of well, we're not coming out of it, and getting certainly much better from the pandemic and the COVID-19. The spread was so fast.
That's correct.
I mean, what leads to it? I mean, if we've sort of been declared, and we're very proud of the status of being polio-free, and that's, I'm talking to the African continent, obviously coming from Pakistan, but how is it transmitted when we talk about polio? And if we are vaccinated, as I know it is a compulsory vaccination, or as we saw the drops that the kids were getting, particularly here in South Africa, if we're vaccinated against it, are we safe?
Well, it depends on how many people are vaccinated. Vaccination does prevent the infection, but when you have a pool of unvaccinated people, they are at risk of getting the infection. And therefore, that's why the drive is to help vaccinate every single child. Polio is transmitted person to person. The poliovirus is shed in the stool of an infected human being. And this stool either goes, especially with children who are unaware of it, they touch their bum, the stool goes from their bum to somebody's mouth, a parent's, some uninfected, some unvaccinated person, or the virus can also be transmitted in water if water is soiled with feces that has the poliovirus in it, or on vegetables. There's all kinds of ways that a fecal matter from a person who is infected can pass to some other person.
Sure.
We have vaccination, it's true, but it depends on the proportion, the coverage of the vaccination. If you don't have every child vaccinated, then there are children who are susceptible to getting infection. The cases, we have one case in New York, an adult male, he had never been vaccinated, and he got the infection from some infected water source. A case of an infected environmental sample in the UK has caused the UK to vaccinate all children 1 to 9 years old in the Greater London area. Therefore, if you've got a pool of unvaccinated people, they are a menace. They are at risk, but they put everybody else at risk.
Fascinating.
So although South Africa vaccinates its children, we don't have 100% vaccination coverage.
Yeah.
And because we do averages, the average of the country might look good, but you have nooks and crannies where kids are not vaccinated. This is a country with a big non-documented immigrant population who probably don't take their children to vaccinate. Therefore, everybody is at risk. And that's why this campaign is going on.
It really is, and it's a very important one, and we thank you for doing this, because it is vital that we certainly do take all precautions possible from polio, which is a devastating illness. Dr. Stella Anyangwe, thank you for talking to us, a global health expert, talking to us about the upcoming polio vaccination drive that is going to be embarked on with 3 Rotary clubs in Pretoria in partnership with the South African Vaccination and Immunization Centre.